Good morning, everybody. Good morning, Judge Daniels. Thank you for joining us today. Can you hear us?
Good morning.
Oh, good. I'm glad you can hear us. Good deal. All right. Well, thank you all for joining us with regard to this press briefing about what the state is doing to respond to the coronavirus pandemic. As always, I want to remind people that we need people to redouble their efforts with regard to all the tools that we've been giving people to be able to help fight this pandemic. That it's important that we continue to keep that 6 feet of distance between us and other people when we're out in public, that we wear a mask, that we wash our hands for 20 seconds at a time. We're asking businesses to de-densify so that they can maybe make it more spread out at work. If you can work from home, please consider working from home. When you go shopping, go once a week by yourself. Don't take the whole family. These are examples of things that we can do that will help us make sure that we slow down the spread of the coronavirus. And of course, we want everybody to avoid the 3 C's, those confined spaces, close contacts, crowded places. That will help us slow down the virus as well, as the virus spreads from person to person. So if you avoid those places, that'll help slow down the spread of the virus. Also, want to make sure that we are doing a good job of following all those rules and slowing down the spread of the virus so we can preserve our hospital capacity. And of course, you can go to testnebraska.com to get tested. We've tested 396,000 people, so almost 400,000 people, or 400,000 test results rather, have been returned to folks here in Nebraska. And over the course of the last couple of weeks, we've been getting those test results turned around in 24 to 48 hours. So we've got a fast turnaround time on that. And of course, one of the things we're very concerned about is our hospital capacity. We have nearly 800 people in the hospital today. However, we still have robust hospital capacity at 31% for hospital beds, 31% for ICU beds, and 71% for ventilators. But again, we want to make sure that we're slowing the spread of the virus because we've seen those increasing cases. Folks, this is serious. September 23rd, we had about 200 people in the hospital. Now we've got nearly 800 people in the hospital. So we've seen a big increase in hospitalizations over just the last 5 weeks or so. 6 weeks or so. So we really need people to follow the guidelines we put out there, to follow the rules, to use the tools to be able to slow the spread of the virus. All right. So one of the things that we know about the virus is that many people get it and have a mild case of it. But we also know that some people are going to be severely impacted by it. And so I have a gentleman here today to come up and talk about his battle with coronavirus, to talk a little bit about that. Also, we know, for example, Senator Mosier had a case of coronavirus that was very serious. He was hospitalized and really, put his health in a precarious status. So we know that if you get the virus, you can be severely impacted by this. And it doesn't necessarily matter how old you are, though we do know that if you're older with underlying health care conditions, you're more at risk. And those folks should take more care, more caution. Kurth Bashir is here to talk about his fight with coronavirus to really help us understand how severe this can be for somebody who is in good health. So Kurth is the, I'm sorry, let me get your title right, Vice President for Institutional Advancement at and Coronavirus Survivor at Concordia University. So Kurth, if I could ask you to come up and talk a little about your fight. Sure.
Good morning, and thank you, Governor, for the invitation to be here and share my experience. As the Governor mentioned, I live in Seward with my family, and we've been generally following the state's guidance throughout this pandemic. We've been wearing masks in public. My wife and I, our employers require masks at our places of work. Our children's school is face-to-face and requiring masks as well. And we've really limited our face-to-face interactions with others. I say that all as predicate for sharing this story, that in September, we had some friends over to our house. We let, as you'll hear me say, our guard down a little bit. These were families with, a few families with kids who go to school with our kids, so they've been masked together all the time. At that time, cases in Seward were not very high, and much of what we were going to be doing was outside. September 24th, after this event, we were notified that 2 of the people who were there had tested positive for COVID. And my wife and I immediately left our places of work. We picked up our kids and began our quarantine as Four Corners Health Department had directed. That same day, I began to have some symptoms, mild, cough, tightness in my chest. And for me, that happens often during harvest season in Seward County, and so I didn't really think much about it. But my symptoms increased over the next several days, and on September 30th, I woke up with a fever, which is unusual for me. I'd had chills a couple nights. My breathing continued to be a problem, and so I was approved for a rapid test at Seward Hospital, and that came back for COVID. So I went into isolation from the rest of my family. They continued in quarantine. Of course, now we were more concerned even if they had it as well. And so they were tested on October 2nd with Test Nebraska. They came back on October 5th that they were negative, for which we thank God. My symptoms worsened. I had coughing, shortness of breath, significant back pain, fatigue, and my blood oxygen levels were lower than they should be normally. And on October 4th, my blood oxygen levels were reading with the pulse oximeter we bought in the mid-80s. A good friend of mine who's a doctor at Duke University in North Carolina, who's been treating COVID patients there, urged me to go to the hospital. And he said really what he'd been seeing was patients at Duke who would experience a rapid decline if they were having oxygen issues. And so we went to Bryan East at that time. My wife took me. They went through a battery of tests for me, as well as a CAT scan to view my lungs. Thankfully, my blood oxygen had stabilized. The test came back normal for COVID, I guess, or at least not concerning. But they also shared with me that I had lung damage. The CAT scan had depicted that I had what they call ground glass in my lungs, which does not sound like any kind of fun overall. They gave me some treatment, sent me home. I will say those next 12 hours were the low point for me in my time. But I did begin to see improvement on October 5th and throughout, and I was out of isolation on October 9th. My family continued in quarantine until October 15th, and thankfully never developed symptoms. I'm told that my lung damage will heal itself over the next several months, as much as anybody can say that. I certainly hope that is true. Several weeks after this, as I shared with the governor this morning, I continue to have joint pain, especially in my back. Not debilitating, but certainly persistent. I continue to need to catch my breath after prolonged exertion. Thankfully, the fatigue ended a little bit earlier. I appreciate the governor inviting me again to share my story, which I would submit is representative of many of those who have COVID in our communities and state. Too much public discussion, in my view, is focused on, regrettably, understandably, tragically, the 2% in our nation who have died from COVID. And each one of those is indeed a tragedy. But I think it creates the impression that the other 98% are fine. We use the term recovered. Well, if recovered means lung damage that we all hope will heal itself and lingering back pain, I'm not sure that that's my definition of recovered. And if I understand, I'm no medical expert, but the studies that are out there say somewhere between 60 to 80% of people who get COVID have symptoms, ranging from very mild to what I've experienced, which is not as severe as many, to the 20% who might need oxygen or a ventilator or be put in the hospital. Then I think we need to start talking about the 60 to 80% of COVID patients who have symptoms and whose health is impacted by getting COVID, as we talk about that. That would mean, in my rough math, 50 to 65,000 Nebraskans have probably had symptoms of those who've had COVID already, of some kind. Thankfully, our death percentage is much lower. But I hope thinking about that, COVID in that way, would help us think about this pandemic a little bit differently. My encouragement is don't let your guard down. It's not about living in fear. It's about simply taking the protocols that have been talked about, the governor's mentioned throughout, to go through this. Take steps to protect yourselves and the loved ones that you care about. Protect the loved ones you don't care about as well. Wear masks. They don't keep you, I will tell you from our experience, from doing anything. We're going to work, we're going to school, we're taking takeout food from the restaurants in Seward to support our local businesses, we're shopping as we've done before, but we wear masks when we're out in public. And yes, we have changed how we handle things at our house if we have people come over. It's understandable, I think, for all of us that we want COVID to be black and white. I would submit this virus isn't that cooperative. Of the 5 members in my family, I was around the 2 people in our home infected the least amount of time, about 30 minutes total probably of what would be defined as close contact. The rest of my family was around them more. They didn't get it. We were quarantined together before I went into isolation for 6 days. My family didn't get it. Again, I thank God for that. And those who do get it, we can't predict what their symptoms are going to be. Whether they're going to go to the hospital, whether they're going to be like mine, whether they'll be asymptomatic, or whether they will die. There is no rhyme or reason to COVID in my view, so I would encourage us to take it seriously. Don't let our guard down. I'm a proud Nebraskan. Some would even say I'm obnoxious about being from Nebraska. I'm proud of the fact that we've always been focused as Nebraskans on ourselves and our communities first. What makes the good life great is that we help each other when we're in need. We see it demonstrated all the time. We don't look to the government first, we look to ourselves and our neighbors. We saw that in 2019 in the floods. We see that when the farmer loses his harvest equipment before the harvest. We've seen that in my community recently with a tragic fire and the untimely death of a young child, where our communities come together and support one another. So I hope that we will, as we have always done throughout our history, and I would encourage my fellow Nebraskans to look out for one another, to look out for ourselves, to do the things we need to do to stop COVID from happening. I would not wish, even at my mild, whatever level you want to categorize it as, I would not wish what I went through on people I don't like, much less those I care about. And so I hope we'll all take the appropriate steps to stop this now. Thank you very much, Governor.
Thank you very much, Girth. I appreciate you sharing your story with us. And I think that does highlight one of the things that we've been hearing from local public health departments as well, which is it's informal gatherings where a lot of the virus is spreading. And that means when you have groups of people outside of a structured environment, outside of school, for example, at somebody's home, and you let your guard down because you think somebody who you know can't give you the virus. Obviously, somebody who you know can give you the virus. We've had numerous stories, whether it was the slumber party by high schoolers that all spent the night together and all came down with it, or mostly came down with it, to people at baby showers and so forth, weddings, funerals. I mean, these are all opportunities for the virus to spread because they're groups of people together. So we need to remember to keep our guard up, follow the tool, or use the tools we've been given, and continue to slow the spread of the virus here by, again, avoiding the 3 C's, that close contact, confined spaces, crowded places. Those are all places where this is going to spread. Now, along those lines, I mentioned earlier that we have increasing numbers of hospitalizations. And so I wanted to talk about our directed health measures. You may recall that 3 weeks ago, about 3 weeks ago, we announced we were increasing the directed health measures we have here in the state. That went effective on October 21st. Generally, those take 2 to 3 weeks to be able to see if you need to do more. And it's a determination that we have made that we are going to need to do more. And again, this is where Nebraskans can help out by, if we're all using the tools we have, following the rules about avoiding the 3 C's and all the other things, that will help us slow the spread of the virus and prevent even more restrictions in the future. So our updated DHM is going to be, we're going to be publishing it today. It will go into effect at 12:01 a.m. on Wednesday, so just less than 2 days from today. And it will include a variety of things. So first of all, we're going to be putting back into the DHM, and a lot of the things you're going to see are things that we had from the previous phases that we had in directed health measures before. We're going to be putting back into the directed health measure the 6-foot separation rule and masking. So for example, we will require 6 feet of separation from organizations that, such as gymnasiums, bars, restaurants, churches, and so forth, that's going to be in the directed health measure that you must keep that 6 foot of separation. That was a recommendation before. Now it will be at restaurants and bars. You have to have that. In churches, it will be household groups have to be 6 feet apart from everybody. Same thing at weddings and funerals. Those household groups have to be separated out, and so forth. We will have 8 people per table or per party. And so if you're going to a restaurant, you'll be limited to those 8 people. If you've got more than 8 people, you have to split that up. If you are going to be at any sorts of other gatherings, like we said, outdoor, indoor venues, again, we're going to be limiting those to either family units or the 8 people, depending on the venue. So, and again, if you are in a business where you have close contact between customers and patrons for 15 minutes or more, masks will be required. So again, you can think back to some of the things we had earlier with regard to massage therapy, body art, tattoo parlors and so forth. Whether you're going to be in salons or barber shops, again, where you have that close contact for 15 minutes or more, you're going to be required to. But other businesses as well. So if you have a business where you are in contact with your patrons for more than 15 minutes, closer than 6 feet, you're going to be required to wear that mask for both the customer, the patron, and the person working in that business. So that will be part of the directed health measure going forward. So please keep that in mind for any business that's going to be out there. For participants at restaurants and bars, if you have to remain seated at your table unless you're standing up to order or using the restroom or playing a game. And if you're playing a game, you'll be required to wear a mask. So that'll be one of the things that is new as well. With regard to extracurricular activities, we are going to be limiting the people who can participate in those extracurricular activities for children to just the household family. So if you've got that indoor, volleyball game or basketball game or whatever, that indoor extracurricular activity, whether it's a club sport or a school-sponsored activity, you will have to bring only the household members, and households will have to stay that 6 feet apart. So this is something that is new as well in the directed health measure. Let's see, we mentioned restaurants and bars, bottle clubs and children's clubs will still be allowed to be able to have dine-in, but again, you're going to have that 6 foot of distance between tables and all the other things that I just talked about with regard to patrons having to remain seated and so forth while they're on premises. Okay, so let's see, next, churches and places of worship, again, keeping that 6 foot of separation between family groups. Gatherings, indoor gatherings will be limited to 25% of rated occupancy with no more than 10,000 people. That is a change. In the previous DHM that we did, that was at 50%, now it's coming down to 25%. Gatherings include, but are not limited to, indoor or outdoor arenas, indoor or outdoor auctions, stadiums, tracks, fairgrounds, festivals, zoos, aquariums, large event conference rooms, meeting halls, indoor theaters, libraries, swimming pools, or any other confined indoor or outdoor space. Outdoor gatherings will still be at 100% capacity. Groups shall be no larger than 8 people. 6 feet of separation between groups involved. Indoor carnivals and dances will be prohibited, though dancing at weddings will be allowed if you remain at your table. So you can still do dancing. Again, this is similar to what we had in the previous DHM. Dancing allowed at wedding receptions, but you have to remain at your table. And same thing just in general for those guests at a wedding, they have to remain at their tables, just overall. Dance recitals will be allowed, but they have to follow all the rules with regard to indoor requirements. And of course, anytime that you're going to be doing one of those events, you have to submit your plan still to your local public health department if it's going to be more than 500 people or 1,000 people in Douglas County. Gymnasiums, fitness clubs, health spas, and so forth. Again, you have to have a 6 feet separation between customers and make sure that is being enforced. For salons, barbershops, and so forth, I mentioned the 6 feet of separation. And again, wearing masks, the exception will be if you're getting a facial or something like that. You can have your face work done, but then the mask has to go back on as soon as that work is done. And we talked about weddings and funerals and making sure that the dancing is just at the table. And again, maximum of 8 individuals In a party, groups larger than 8 will need to be split up into multiple groups. So those are the new DHMs that we'll be publishing today that will go effective 12:01 a.m. on Wednesday. So again, folks, this is very serious. We've got nearly 800 people in the hospital. We need Nebraskans to do as Chris talked about. Step up, redouble your efforts, make sure that you're not letting your guard down in those informal gatherings, limit the size of group gatherings, wear your mask when you can't, you keep that 6 foot of distance, go in the store, wear a mask, wash your hands often, that actually kills the virus. Work from home if you can, avoid those 3 C's. All these things will help us slow down the virus. Good ventilation, another thing that's going to be important. If you have a room, good ventilation will help improve the ability to slow the spread of the virus. So again, folks, we really need people to pitch in and help out to be able to take care of each other and slow the spread of the virus so that we can preserve our hospital capacity. Again, 800 people in the hospital. 6 weeks ago, that number was 200. So we're seeing rapidly rising hospitalizations. We need everybody's help. Now, we're going to move on to another topic before we come back to questions and answers. And this one is a little happier announcement. We're going to be talking about Adoption Month. Now, many of us have a family where we grew up and we've had our parents that have taken care of us. They sang to us when we were little, taught us to read, took us to school, took us to those events, like dance recitals, or baseball games, or football, or so and so forth, to be able to help us out. But we do have children that their biological parents cannot take care of, and then they end up in our foster care system. Now, our Department of Health and Human Services has really worked to make sure we keep kids out of foster care, keep them with their families. In fact, we've reduced that number by about 20% over the last 2 years. But in those cases where the child can't remain in the home, we look to find a forever home, a permanent replacement, somebody who will adopt that child. Now, last year in the state of Nebraska, we had 457 kids that found their forever home here in the state of Nebraska, thanks to the Department of Health and Human Services. One of the people who has been a part of that process is the gentleman we have here on the screen, Judge Vernon Daniels, who is with the separate juvenile court in Douglas County. And in Omaha specifically. So he has seen cases of child neglect, but he's also seen the joys of adoption. And as we enter into Adoption Month here, I'm going to ask the judge to speak, but I also want to recognize that we have Sarah and Haley, Buckles, did I get that right? An adoptive mother and an adopted child. So thank you very much for joining us here today. And with that, Judge, I'm going to turn over to you to say a few words.
Thank you, Governor. Thank you. And you're very correct. November is a very happy month for us in the juvenile courts, and not only the juvenile courts, but the various county courts with adoption jurisdiction. It's so important to us because we have so many children who have been scarred, who have been hurt throughout their lives, and on a daily basis in the juvenile courts, we work to put together rehabilitation plans in hopes that parents and children can be reunited. Unfortunately, we know that that's not always possible. Then we seek permanency for children. We want permanency for children with individuals who will love them, care for them, and treat them as if they were their own birth child. And we've been very lucky. Standing in the wings are these quiet angels, our foster parents, who are there to cushion this fall, this hurt for children of whatever age it may be, and welcome them into their home as a full-fledged member of that family. But Governor, we have other hidden angels here that we don't always recognize. We always recognize as the judge. We always recognize judges. Only thing we do up there, we just bark out orders. But out there on a daily basis are our social workers, our case managers, our mental health professionals, our guardian ad litem, attorneys of all yoke there in the court, as well as our CASA workers, all out there meeting with the children and families and making them understand and know that they are a part of a family and they're not just another file for us. And so November is a happy month. Usually the Saturday before Thanksgiving is our National Adoption Day. Things are a little different now, but I am confident that we will be back together again. And when we see them all, we will all be able to give them their little bears, recognizing and honoring their special day. So thank you all. I want to thank all of those families out there who do so much for our children, and to those children out there, we haven't forgotten about you, and we're very happy for you.
Great, thank you very much, Your Honor, for joining us here. I am now going to sign the proclamation proclaiming this month Adoption Awareness Month here in Nebraska. We will make sure that you get a copy of it. But if you hold on just a moment, you'll be able to see that we are now officially proclaimed Adoption Month Awareness here in Nebraska. So thank you very much, Your Honor, for joining us. You're welcome to stick around. I know that you may have other things that you've got to do, so understand if you've got to leave us. We're going to continue to talk about Adoption Month here, though. But thank you very much.
Absolutely. Thank you so much. Have a good day, everyone. Stay safe.
Thanks. Well, as Judge Daniels mentioned, it is a happy time to be able to get kids into their forever home. Here in the state of Nebraska, we've got about 50 kids that are ready to be able to find their forever home. I mentioned last year we had placed those 457, but we do have 50 kids available, or kids that are ready right now to find that forever home, to be adopted. So we certainly encourage Nebraskans to take a look at that and find it in their heart if they're ready for that step in their lives. When we find a child a permanent home, that forever home, we know that that child is going to be more likely to be involved in extracurricular activities than the non-adoptive peer. We know they're generally going to be doing better in school. They're less likely to end up in some sort of trouble, and they're more likely to go on to college. So those adoptive homes are very important in providing that support and love to those children who are looking for that forever home. So we're very excited to be able to talk about that here today, and we've also invited Candace Holder, who's our Eastern Services Administrator for the Department of Health and Human Services, to come talk a little bit more about our adoption program and what it all involves. So Candace, that's all you got.
Good morning. Thank you, Governor, for inviting us, and thank you very much for highlighting National Adoption Month. As mentioned, my name is Candace Holder. I'm an administrator with the Division of Children and Family Services within the Department of Health and Human Services. Also, as Judge Daniels and the Governor also mentioned, our teams work diligently every day to try and make sure children and families are safe, and to ensuring that they have the resources and the supports that they need, not only to be successful, but to thrive. When it is necessary for safety that a child be placed in out-of-home care and in state's custody, our first line of order is to provide those resources to try and reunify the family. Unfortunately, sometimes that is not possible, and reunification is not safe. In those situations, we are then charged with ensuring children receive timely permanency, and sometimes through adoption. While so far in 2020, over 300 children have been adopted from our Nebraska foster care system, as mentioned, there remains many other children who are in need of a forever home. For our youth in foster care, joining an adoptive home means that they belong and are connected to that home that will support them into adulthood and beyond. Our slogan, "Open your heart and your home," really does articulate that being a foster home is more than just providing the physical space. It is providing the bond, nurturing, and unconditional support that we all need to be successful. In Nebraska, we're very fortunate to have the Nebraska Heart Gallery. The Nebraska Heart Gallery is an online interactive site that allows potential adoptive families to locate and connect with foster youth who are in need of an adoptive home. The Heart Gallery was created in 2005 as a way to highlight our youth in foster care, most often older youth and teens who are in need of an adoptive home. Often when one thinks of adoption, they think of babies and young children. but there is a great need in Nebraska and across our country for adoption for older youth and teens. On the Heart Gallery, you can read more about the youth who are currently available for adoption in Nebraska, their stories, pictures, and needs. Older youth and teens really want to be a part of the process and a part of the decisions that are made about their lives. And the Heart Gallery does a great job of highlighting that and making that voice heard throughout the process. Nebraska will be running various social media campaigns to highlight awareness and the need for adoptive homes for youth and teens in our foster care system. You can find more about the Nebraska Heart Gallery at nebraskaheartgallery.org. Once on the site, please share these gallery posts to anyone in your networks and social media contacts who might be interested in learning more about adoption or foster care. Additionally, you can contact 1-800-7PARENT to learn more about becoming a foster or adoptive home. During National Adoption Month, we honor those who have already expanded their homes through adoption and are grateful for the support, commitment, and love you provide. We have a continued need for additional adoptive homes, and the challenges of COVID-19 have only increased our need for adoptive homes who can commit to providing the home to the youth in our community. Please consider ways you can provide a heart and a home today. Thank you.
Camus, thank you very much for being here, and thank you to you and your team for all the great work that you've been doing to help take care of the kids here in Nebraska. So thank you very much. All right, with that, we will now go into questions and answers. Just a moment here. Got a couple I know that were submitted ahead of time. From Lee Waldman, WWT, Governor, healthcare providers across the state are calling for more to be done to slow the spread of the COVID-19. Again, obviously, we just announced some additional DHMs the additional DHM that we're going to be tightening the restrictions down on gatherings, on different businesses, and so forth, with regard to sizes of groups, wearing masks, and so forth. So just was asking what is your next step, and obviously that's the next step. Can you respond to the recent fallout on Twitter regarding one of your staffers? So again, Twitter is a place where people exchange ideas, and your ideas are going to be challenged, and that's just part of the process there. Looking for holiday recommendations for Nebraskans when it comes to safely celebrating. I mentioned this a couple of times last week. Thanksgiving is coming up. Encourage people to think about the size of family get-togethers and reducing those sizes so that you can reduce the opportunity for that virus to spread. As we heard from Kurth, again, people you know can give you the virus. So those informal gatherings can be a place where the virus spreads. So please thoughtfully consider the size of your Thanksgiving celebrations. Maybe look to break those family groups up into smaller groups so that you can reduce the spread of the virus and avoid the crowded spaces and crowded places, or confined spaces and crowded places. Martha Stoddard from the World-Herald. What is your reaction to Joe Biden being declared president-elect? Well, I think it's important to understand that media outlets do not elect a president. It's done in the states and certified by the secretaries of state in those different states. There's lawsuits outstanding on this. There's probably going to be recounts, so just encourage people to remember that as they're going through this process. So we have to let the legal process work its way out with regard to this election. Do you agree with President Trump's contention that the election is being stolen? Well, I think that, again, we have to let the legal process work itself out. There's a number of questions that are out there. We have a legal process in place to be able to review when somebody has a disagreement with regard to, for example, whether ballots should be counted or how they were counted and so forth. And that's what we need to let work out. We need to let that legal process work out. We're a nation of laws. We have the rule of law here in Nebraska. We have the rule of law in the United States. We need to let that rule of law work its way through this process. And do you agree with Taylor Gage's tweets questioning the political affiliation of doctors calling on stronger public health measures? Again, Twitter is a place where we have people put their ideas out there, and those ideas are challenged, and that's just part of the social forum that we have with regard to that. So everybody's entitled to be able to have their different opinions and understand that's the form that we have there with Twitter, is that it's a place of exchanging ideas. Okay, those are all the questions I had submitted ahead of time. Taylor, did you have more?
There's a few more. Tyson Herbronick wants to know, on the extracurricular activities, will the media be allowed to broadcast and cover those games for those who will not be able to attend?
So the question was from Tyson Hervanek, will the media be able to allow to cover those games and be able to broadcast that? And my answer will be yes, so let's go ahead and just make sure we make that clear with regard to the directed health measures, so people who cannot be there will still be able to see it.
Rob McCartney wants to know, is there going to be stepped up enforcement if someone violates a DHM?
So Rob McCartney wants to know, is there going to be stepped up enforcement if somebody violates a DHM? Local law enforcement will be responsible for enforcing DHMs.
Julie Anderson from the World-Herald says Utah, which has lower cases per capita than Nebraska, has implemented a mask mandate and limited social gatherings to households only until November 23rd. Why not go stricter with our DHMs?
So Julie Anderson, the World-Herald says Utah has fewer cases and has more strict measures than we do. Why not do more strict measures? I think that's one of the things about our country, right? We have 50 states. Everyone manages it differently based upon their unique circumstances. And we're taking the steps here to be able to manage the pandemic and look to protect our hospital capacity. And we're always going to evaluate our DHMs to see if we need to do something different.
Andrew Mim wants to know, will you mandate 6-foot distancing at big retailers like Walmart and Target?
Andrew Mim wants to know if we're going to be mandating 6-foot distance at big retailers with regard to like Walmart and so forth. My understanding is most of those retailers are already doing that 6-foot distance. They should be doing that for their customers right now. And if their customers are not keeping that 6-foot distance, they should be wearing a mask. So that's, again, that's really kind of covered in the DHM, that in places of business where you've got people going to be closer together, they need to be wearing a mask.
And then Tara Campbell from WOWT says, with rising cases of coronavirus in rural areas, will you consider a statewide mask mandate and directed health measures to protect communities who don't often have easy access to hospital care?
So I'm sorry, it was Tara Campbell?
Yep.
Tara Campbell's asking, are we going to consider a statewide mask mandate? No, we're not going to do a statewide mask mandate. The masking that we are doing is covered in the DHM with regard to specifically, if you've got one of those businesses where you're going to be in close contact with one of your customers for 15 minutes or longer, that's when we're going to put it in the DHM that you have to be wearing a mask. That's the same rule that we've been using all along through this pandemic, that we've said is, you know, wear a mask when you go out in public. If you can't keep that 6-foot distance, if you've got the, you know, can't avoid the 3 C's, you got to go to a crowded place, confined space, or close contact. That's when we're saying wear a mask. That's what's in the DHM.
That's all I got.
Okay, great.
Governor, do you think Nebraska municipalities have the power to mandate masks by ordinance?
So Fred Knapp is asking, do I think that Nebraska municipalities have the power to mandate masks by city ordinance? That is certainly true in the case of Omaha, as we've discussed. And different municipalities will have to go check their own rules and bylaws and, you know, consult with the local public health departments or somebody with regard to what their actual authority is. So we know for sure Omaha has, we know Lincoln does because it was a separate carve out in state law, but the home rule charter for Omaha allows them to be able to pass that ordinance. Other cities may be able to do that too. Yeah, Andrew.
Do you encourage cities and local municipalities to take that step, or do you create a patchwork?
Do I encourage cities to pass a mask mandate? As I've said all along, I think mask mandates actually just breed resistance from people. If you want to know how that works, go look at when Omaha City Council passed it and the people showed up there. We can see it other places around the state as well. I think what we have to do is continue to educate people about when you use a mask. Certainly in our DHM, we are requiring it in places where you've got that 15-minute contact of, you know, close contact. But we want people to understand how to use that. It's a tool to be able to help slow the spread of the virus. That's not our only tool. We want people to keep that 6-foot distance, wash your hands. We want people to adopt with other things too, like try to work from home if you can. When you go to the store, go by yourself. Don't bring the entire family. Only go once a week. These are all things that we can do to help slow the spread of the virus. These are all tools in our toolbox.
Governor, if President-elect Biden were to approach you about a mask mandate as has been outlined in this transition plan, what would your response be?
So the question was, if President-elect Biden is indeed confirmed to be the next president and he approaches me about a mask mandate, I would not be going along with a mask mandate. I'd be keeping the same policy.
Steve White from NTD said, did the new directed health measures take into account essential workers like those in agriculture?
So Steve White says, do the new DHM take into account essential workers like agriculture? Again, we don't make that distinction here in the state of Nebraska with regard to essential workers. We never have made that distinction with regard to essential workers in our DHMs. So what we're asking is, again, everybody needs to follow these rules. We're not prohibiting people from working, right? But we do need people to follow, for example, if you're gonna be in that close contact with a customer for 15 minutes or more, you need to be wearing a mask.
And then Rudolph from KMTV wants to know when the DHMs expire.
Great question. So Rudolph from KMTD wants to know when the DHMs expire. As I mentioned, they'll go into effect at 12:01 on Wednesday and will last through November 30th. Thank you for that update, or that question, to help us clarify that.
Governor, if it's fair game to question the doctors who want you to do stricter measures based on their political affiliations, is it fair game when people say, oh, Ricketts is just holding back because he's a Trump supporter?
So the question was, fair game on Twitter to be able to talk about it? Is it fair game to say Ricketts is just holding back because he's a Trump supporter? We've taken the approach the entire time along that we're going to work to be able to preserve our hospital capacity. I've said we're going to try and keep it as light a touch as possible so that we can preserve people's freedoms to the extent we can, and trying to find that balancing act in between the two. So I will tell you, the president, as President Trump has never called me and told me I had to do one thing or another. We've set up phone calls with the White House staff, listened to their advice. We've listened to the advice of other doctors and epidemiologists around the state and the country, and we take all that into consideration as we're making the decisions with regard to how we do our DHMs. And as I said when we announced our first tightening of DHM several weeks ago, that we would reevaluate as we got a couple weeks in to see if we need to do more, and our evaluation of that is that we need to do more. Andrew.
And how do you address I guess two parts. Number one, how do you address the people that say too little, too late? And the other people that say too much, too soon, we need to let herd immunity take effect?
So the question was, how do you address the people who are saying this was too little, too late? And how do you address the people who are saying this is too much, too soon, essentially? That we need to allow this to run further. And again, that's where we're looking to be able to strike that balance between slowing the spread of the virus, preserving our hospital capacity, and then preserving people's freedoms and allowing people to go back to a more normal life. We are going to have to take more steps to reduce our mobility. Again, mentioned, go to the store once a week, don't take your entire family. Try to work from home if you can. Those are the sorts of steps we're asking people to do now. We've asked businesses last week to be able to start de-densifying their office spaces. We've got a plan for doing that here at the state of Nebraska. So we are asking people to make some changes. We know that some people don't like them. We know some people want us to do more, but we're trying to strike that balance in between.
And how close are you to, I guess, calling for a shelter in place? I mean, the mayor basically asked for a voluntary shelter in place. How close are you?
The mayor of
Lincoln, I'm sorry.
So the mayor of Lincoln called for a voluntary shelter in place. Am I close to calling for a shelter in place? We did not do a shelter in place in the spring, and we're not looking at that right now.
Governor, when you suggest, say, that mask mandates breed resistance to, the use of masks, what are some things that you could cite as something to support that claim?
Sure. So if you looked at just the city council meetings in Omaha, where quite a number of people showed up opposed to that. If you look at what's going on here in Lincoln with the lawsuits, I know other cities have looked at passing mask mandates, and at least one other city I can think of looked to do it and didn't do it because the number of people showed up, or just travel around the state and talk to people. You can see that there are people who don't want to be told when they're supposed to be doing something, and that's where I think we just need to remind people about when the right role for wearing a mask is. And getting back to our 3 C's and avoiding those if you can't wear a mask there, talking about wearing it when you go to the store. All these are things that we continue to work to educate people. And frankly, as you look around the state, certainly we see much more masking up that's going on now than we did at the beginning of the pandemic, and we've seen that continue to go up. So I would say that as we continue to get the message out there, more people are masking.
Do the data show that Lincoln and Omaha, with their mask mandates, are doing any better than anywhere else in the state?
So the question was, do we see that the data show that Lincoln and Omaha, with their mask mandates, are doing any better than other parts of the state? I don't have that data off the top of my head, Fred, though I can tell you both Omaha and Lincoln have seen increasing cases and hospitalizations like the rest of the state had, but I don't have that data right off the top of my head. All right, I don't see any other questions? So we'll go ahead and, oh, yeah, go ahead, Andrew.
Is there a chance you may implement more tighter restrictions yet this week, or will you wait 2 weeks before you reassess and then decide to do something different?
So the question was, is there a chance that I'm gonna be doing more restrictions in the DHM this week? Or will we take a look and see what happens first? We will, again, you generally need some time to see if a DHM is gonna work. So we're unlikely to do anything additional on a DHM this week. Though we will always continue to evaluate that and make the best decision at the time we think we need to.
And what have you heard about, a possible vaccine, developments on a possible vaccine?
So Andrew's also asking about what have I heard about a possible vaccine? And my understanding is that the federal government, this was actually, now it's week before last, so the day is a little bit old, almost 2 weeks old. But at that time, the federal government was expecting that we would have a vaccine, at least one vaccine in December. So they were optimistic we would be able to start rolling that out next month. Obviously, they still have to, any vaccine would still have to be approved by the FDA. And while we've got a number of vaccines that are in that phase 3 and looking to make that request to the FDA is still gonna have to be satisfied about the safety and efficacy before they'll approve that. And so we'll just have to, we're hopeful that we'll see something in December, but obviously there's no guarantee.
Can you say anything about contingency plans if hospitals reach their capacity?
So can I say anything about contingency plans if hospitals reach their capacity? And this is part of what we're doing with regard to working together with the hospitals. So for example, making sure that we're moving patients, if we need to move patients to be able to provide that care. I would say one of the great things we have here in the state of Nebraska is our hospitals are really working well together. They're collaborating very well to be able to do that. And so we're just going to continue to work on different things. For example, I know some of the things that hospitals will do is start scaling back those other surgeries they've got planned to be able to make sure they've got room to take care of COVID patients. We're going to be looking at, well, what are the hospitals that are just kind of outpatient or very short stay surgical hospitals that normally wouldn't take a COVID patient, but how can they offload some of the work from the major hospital systems that are taking COVID patients? So there's a number of things that are in the planning to be able to continue to accommodate the people coming into the hospital.
And is there a disconnect between what hospital officials are saying with the bed capacity and what the doctors, or some doctors are saying?
So the question was, is there a disconnect between what the hospitals say, CMOs and CEOs are saying about hospital capacity versus what some doctors are saying? Again, I would say that the people who are responsible for actually managing the staffing, the beds and so forth, are the folks who probably have a better insight into what the capacity issues are. Not that the feedback of the doctors who are on the front lines isn't important. It is important, but again, the folks who are taking the bigger picture view are the ones that actually have to manage that capacity. So again, I think it's about striking a balance, and we're certainly listening to folks both sides. All right. Well, again, folks, thank you very much for joining us here for our press briefing. We will have press briefings again later this week, tomorrow at 2 p.m. and on Thursday at 2 p.m. Wednesday is Veterans Day, so happy Veterans Day to all of our veterans across the state of Nebraska. We appreciate all your great service. And again, we want to remind people, please, please, continue to use the tools we've given you to slow the spread of the virus. Make sure you avoid our 3 C's. Wear that mask when you go to the store, wash your hands, keep that 6 foot of distance when you're in public. And again, as we heard from Kurt Brashear, those informal gatherings are places where the virus can spread, so please don't let your guard down. Thanks again, and we will see you here tomorrow at 2 p.m. And then, Taylor, we're going to do a picture?
Yeah, they really want to go photo.